This presentation is intended to serve as legal information only and does not replace legal advice. That being said, welcome to today's Facebook Live. I'm here connecting and sitting in the rooms with staff attorney Elizabeth Green, who's our subject expert, and she's going to give us a lot of information later, and with our very special community partner, Jordan Everett, and she is representing the Civic for Public Policy Improvement. And I didn't introduce myself. I'm Karen Richard, and I'm the outreach specialist for Connecting Kids to Coverage, and that's our Medicare and CHIP insurance project. And before we get started, I'm just gonna share a little bit about Lone Star Legal Aid. We are a large nonprofit organization that's been working for more than 70 years in 72 counties in Texas. We work with education, advocacy, and civil legal representation. And I like to confess that I've been there about 3 years, and I really enjoy working with community partners like Jordan. And it's because pretty much I'm enjoying connecting with agencies and organizations like hers because they have a similar mission, that mission of educating and advocating and protecting and advancing the rights of people who just have a hard time getting those things. And so that's why I'm excited for today's Facebook Live segment. And with that said, I'm going to hand the mic to Elizabeth.
Hi, so I'm Elizabeth Green, the staff attorney, like Karen said. And so today we're just going to talk a little bit about Medicaid and CHIP benefits and then policy within Texas. Jordan, do you want to give us a little bit of background about your organization and what they do?
Yeah, so hey everyone, it's good to be with you, Elizabeth and Karen, and everyone watching, and all of the staff at Lone Star Legal Aid. They're excellent partners and provide such important services and such an array of services in our community. The Center for Civic and Public Policy Improvement is, of course, a public policy agency, and we have 4 main focus areas: affordable housing, healthcare, education, and criminal justice and safety. Our root focus is affordable housing. So, we believe that if you don't have a safe, stable, affordable in your means place to call home, to have a roof over your head, that all of those other areas are, dramatically impacted. But another area that we're very passionate about is also that connection to not just healthcare, but people's health. And we did a lot of advocacy around Medicaid expansion. And so that's how we connected, is through this work on getting people connected to the healthcare coverage and insurance that they deserve.
Awesome. Do you have any questions for me when it comes to healthcare or Medicaid, anything like that?
So many questions, Elizabeth. Yes. So I think the first question I have, because I think people get just confused based off of all of these big government programs that have all these different titles and acronyms and all these sort of things. So what is the difference between Medicaid and CHIP? You could explain that.
Right. Yeah. A lot of people don't know that difference, especially a lot of our clients. And so just to begin, Medicaid is completely free, right? So if you apply and get enrolled in Medicaid, then it's completely free for the family. They don't have to pay any cost when they go to the doctor. They don't have to pay any cost when they go get any type of prescription drugs. CHIP, which is also known as the Children's Health Insurance Program, it's going to be a certain amount of cost to the family. They are going to have to pay an enrollment fee, and they are going to have to pay copays, very low copays when they go to the doctor or get prescription drugs. So that is the major difference. Another major difference is the income limit, right? So the income limit for Medicaid is going to be lower than the income limit for CHIP. So first families get tested for Medicaid and then they get tested for CHIP. So if the family doesn't qualify for Medicaid, they potentially could get the CHIP benefits.
Okay, that makes sense. And that kind of leads to the next question of who are the families that qualify for these health coverage benefits? Who are the families that you're working for? Who are the families you're trying to outreach to who might not know about you yet?
Right. Yeah. So first, to qualify, the child has to be 18 years or younger. Typically, there are some exceptions to that rule, but majority they have to be 18 years or younger. Another qualification is they do have to have qualifying immigration status or be a citizen. For Texas, they have to be a Texas resident because you apply for that specific benefit within the state. And then you have to be under the income guidelines, but those are a little bit more complicated, right? Because they're using the federal poverty guidelines, and that's gonna vary based on household size. So for a household of two, that's going to be a lower income limit than a household of three. Even further, the income limits vary based on a age group. So there are three age groups in Texas. They're called TP43, which is ages 0 through 1, TP48, which is ages 1 through 5, and then TP44, which is ages 6 through 18. I'm sorry. And the higher the age group, the lower the income limit, right? And then those are going to be within 198% and 144% of the federal poverty guidelines, but CHIP goes up drastically to 201% of the federal poverty guidelines. So to give you an example, a household of two for a 6 through 18 age group is going to be $1,931 as income limit. That's going to go all the way up to $2,918 for CHIP. So those are the major differences between them.
Cool. So I think this is probably a question that a lot of parents have and caregivers who are looking to make sure, their kids get the health care that they need. What are the services that are covered under Medicaid and CHIP?
Yeah, so it covers a vast amount of services. That's going to be dentist visits, doctor visits, eye exams, your choice of doctor, prescription drugs and vaccines, access to medical specialists, hospital care, treatment of special health needs. That's also very important because a lot of people don't know that it'll cover things like occupational therapy or speech therapy, right? So I get clients that are in that. So it just covers a number of services, and those are just a few.
And then do y'all help people figure out what services they need to, or is that a different space?
Yeah, so we can, I always ask clients, hey, like, do you know what this covers? I don't necessarily like help them search for a provider, but I do tell them how they can look up a provider or how they can find that information, tell them what services are covered. Sometimes clients will call in and ask questions about what services are covered, and I can inform them about that. So that's probably a lot of what my work is geared towards too.
Yeah. Okay, cool. Makes sense. So I know that a lot of the outreach work that like Karen focuses on is and some of the stuff we've been partnering on is getting out into the community. We're a lot of our work is focused in the third ward, although we work in a lot of other communities as well. But so in terms of that and going out and talking to people, what does that enrollment process look like for them? Like how do families get registered? What does that look like?
Yeah, so when we go out and we host enrollment clinics, essentially we're telling them, hey, these are the ways you can apply. You can apply by paper, and you can mail that in or fax it in. And you can apply online on your texasbenefits.com. Our outreach work is geared towards applying on site for applicants and families. So what we'll typically do is host enrollment clinics and market it and ask them to bring the correct documentation. And then we can go ahead and because we are community partners with Health and Human Services, we can go ahead and fill out the application on their behalf while they're there, as long as they consent to it, or assist them with filling out the application, right? So that's going to be the beginning of that process, just filling out that application. From there, Health and Human Services does have 45 days to respond to that application. They can respond sooner if they would like, but they can take the 45 days to approve or deny them. If they are approved, right, they're approved for Medicaid, right? Because remember earlier I stated that they're going to test them for Medicaid first before testing them for CHIP. They don't qualify for Medicaid, then Health and Human Services will automatically test them for CHIP. If they are approved for Medicaid, they will automatically get enrolled and they'll be sent out a Medicaid card. They'll be sent out a list of providers that they can choose from. And then they can present that card when they go to the doctor on behalf of the child. CHIP is going to be different because it's a different, it's managed by a different organization, right? Called Managed Care. And they're going to send out a packet to the family and they're going to have to fill out that packet. They're going to have to pay that enrollment fee before they can get enrolled. So they'll get approved first and then they complete that process and then they will be enrolled into the CHIP benefits.
And Karen, I think has a question or a
Yeah.
question from our audience, but I think like you just going through that, and I know that's a broad system level, like explanation, and the day-to-day is even more detailed. So very understandable as to why, your services are so important to help people go through that process, because it can be very confusing.
Right. And then also, I just wanted to say that we also appeal. So like I said, best case scenario is we do fill out that application for them and they get approved within that 45-day time period. And we either help them through that CHIP enrollment process, or we tell them, hey, this is how long it's going to, take for your Medicaid card to come in, right? But if they are denied, right, as the staff attorney on the team, we are appealing those denials and representing them at hearings, and trying to negotiate with the state representative to go ahead and get them benefits. So that's typically what we do from that process on.
Yeah, and that's an added service that would be a difficult step for, clients that you have that are obviously low income because they're possibly qualifying for Medicaid or CHIP, like to be able to go and find an attorney and go through that appeal process. So yeah, Karen,
Right.
yes.
Right. Yeah, thanks, Elizabeth. I'm glad you said that. I just wanted to reiterate that that's why it's so important to connect with our community partners. And that's why our relationship with Jordan has been so valuable. While we're busy connecting kids, Elizabeth and the team actively enrolling children and families in Medicaid and CHIP at schools and churches and community centers. We're busy connecting them. Elizabeth is actively enrolling them and appealing denials. Jordan has been busy connecting us to potential community partners that hold that are watering holes, so to speak, for these for community members, because we want to connect with them where they live, where they work, where they play. And so it's been so valuable and so important and so wonderful to have Jordan come along and say, hey, Karen, did you know that so-and-so is having a vaccination event, or that they're having a health and wellness event, or that they're having a national night out? And here's the partner that you can speak with. So I wanted to publicly say, before we got into talking to Jordan about her organization and the wonderful things they're doing, thank you, Jordan, for connecting me to those important community partners, because without us working hand in hand on site to enroll and to have these enrollment clinics and education, then we wouldn't be able to, our project wouldn't be successful. Thanks, Jordan. I appreciate it, and I'm looking forward to continuing.
I was going to say that. Yes. Thank you, Karen. And we will at CCPPI, we will definitely continue that partnership and relationship and making sure, because obviously like the goal is to get our goals are also to, improve policy when it comes to healthcare, but connecting people that don't have access to the policies and the coverage that we already have in place is such an important, like those two pieces coming together is really important.
Right. And so I'm not sure if you had any other questions, or did you, Jordan, before I ask you or before I let you talk to us about your organization?
Yeah, I think a couple more things for Elizabeth. I think we covered this a little bit, but how does a parent find a provider who accepts Medicaid or CHIP in their community? Because obviously we live in a big city and there are a lot of providers. But...
Right, yeah, and that's a question we get from clients all the time. One of the best ways I direct them is that they're going to be sent a list of providers, and they can choose from that. They do have a time period in which they have to choose from, or Health and Human Services is going to choose for them. So that's one way. They also can go to hhs.gov and look it up that way, right? And go to their specific state and choose and look at a list of providers to choose from. But those are just going to be the typical ways. I can't do too much as far as that with the client, because they are the ones that are going to be in charge of choosing which provider is going to be best for their child, right? But that is where I direct them so they can choose. And then I let them know they need to do it as soon as possible so they don't get chosen. The Health and Human Services doesn't choose one for them.
Yeah, I didn't know that. So, and then what, you all have touched on this, but if you can just give what are all of the types of services offered through Lone Star Legal Aid's Connecting Kids to Coverage program?
Yeah, so just to begin, we provide application assistance, right? Navigation assistance. So we're going to submit that application on behalf of the client with their consent. And then once we do that, that's not where we leave them. We do know there's a 45-day waiting period. And so in that 45 days, we're calling Health and Human Services, talking to them, asking them, is there an update? We're monitoring their accounts to see if they need to providing more documentation, right? Because sometimes clients submit an application and Health and Human Services will request more documents, and we know they only get 10 days to submit those documents, right? So we're monitoring their accounts to see if there any documentation that's needed. We're talking to agents on their behalf to see what's going on, right? And then from there, that's when I would step in if they were denied, or let's say the 45 days is up and they just haven't heard from Health and Human Services, right? I can still appeal for inaction. So those are some of the major things that we do to assist clients in getting enrolled in those benefits.
Okay. Yeah. And we talked about the outreach on top of that.
Right. Yes.
And then it sounds like, and also people have barriers to technology. So it sounds like there's some support just from working with you all that can alleviate some of those barriers with like sending in documents, and I don't know if it means scanning and signing things and all of that.
Absolutely. Yeah. We have a lot of clients who are like, I don't have access to a computer. I don't have access to fax this, and it's due tomorrow. And I can just say, hey, send it to me via your phone, and then I can fax it in, or I can get it to Health and Human Services, right? So that's sometimes a major barrier that we do provide.
Yeah. That just came up in my head while we were talking about this. We hadn't talked about that before, so it's very important.
Yes.
And then the last programmatic question before we get a little more policy and kind of bigger picture focus. Is this an ongoing effort that Lone Star Legal Aid has? Or is this like a campaign that has an end date, or what is going on with the keeping kids or connecting kids to coverage?
Yeah, at the moment, there is no specific end date. This program is an ongoing effort by the National Center for Medicare and Medicaid Services to keep providing assistance. So there is no specific end date, and we're going to keep assisting as long as that campaign is ran by CMS. So,
okay, cool. That's good. So I wanted to ask you a policy question, because we did a lot of advocacy work with our partners at Children's Defense Fund Texas, and they run a campaign called the Sick of It Texas campaign, which is around Medicaid expansion, but of course, children being covered and also their parents being covered is a very interconnected health policy issue. But anyway, so in the 87th Texas legislative session, which ended back in May, HB 290 was passed, which was by Rep. Cortez. And that was super exciting. We did a lot of advocacy work to get that passed, a lot of health policy people on the ground. And so 290 protects eligible children from being pushed off of their Medicaid coverage. And when this happens, or is hopeful, we're going to talk about that, but when this was happening, children would lose access to doctor's visits, therapies they needed, vision support, get glasses, prescriptions, inhalers, all this sort of thing. So I wanted you, Elizabeth, just in your role, to talk about 290. Has it had any impact yet, or what do you think the future impact will be to y'all's work?
Yeah, I think that's a great question, Jordan. So we haven't seen any direct impact because it did just go into effect on September 1st, but we are hoping that, in the future it had, and we think that it'll have major impact, right? Because, essentially the passage of that means that they go from checking in quarterly, doing income check-ins, household check-ins, and sometimes in error, kicking a lot of the kids off of benefits, and they can't see their doctor. Sometimes parents will just go in one day after we have assisted them in applying and getting enrolled in that process and say, hey, they'll call and say, hey, I tried to take my child in for a checkup and the doctor said they don't have Medicaid anymore. What's going on? And we think that it'll benefit them because that won't be happening, right? They'll just have one annual check-in versus the quarterly one. And then that will retain a lot of kids on those benefits, right? And we just think it'll impact just because I've had to file appeals just because they're being kicked off erroneously. So I think it'll have major impact on our work going forward. But as of now, because it just went in the beginning of the month, I haven't seen the impact as of yet.
Yeah, I think a lot of people were just, before, it was policy that just didn't make sense, and it really didn't make sense for the clients and patients and children and their parents who are served and who are covered by Medicaid.
Right. Yes, I completely agree. I think, checking in quarterly when they've been approved, they've already checked in for their income, and terming them out, that has a major impact on the family, right? Healthcare in general is going to be important for kids, right? To their growth, to their health, to sometimes just doing well in school, things of that nature. So I think terming them out, and checking in quarterly that would have a major impact on any family. So I'm really happy that going forward, that should change that.
Yes, we are very excited to see that pass. Oh, sorry, go ahead.
I'm sorry, excuse me. Can I ask a question here? Because this is, the House bill. So how will I hear you talking, Jordan, and Elizabeth, I hear your answers and I understand, but how will the public understand that they don't have to check in quarterly? Will they just, will they see television ads or radio, or how will they know that things have changed? Does anyone know? Have any thought about how word will get out?
That's a good question, but I feel like a lot of the outreach work y'all are doing, and I don't know if there's, calling current clients, be like, hey, good news.
It is an opportunity for us.
It's a stressful thing, right? People were very stressed at having to do that before, or it's just life happens and they're busy and they're working parents and all of this sort of thing, and they aren't able to, and then they're getting kicked off. It's the good news is that it's once a year now, which is much more reasonable. But I don't know, Elizabeth.
I think my answer to that question would probably just be people like us that are on the ground doing outreach and informing them, right? Because I don't think that a lot of our clients don't even know that they're getting quarterly check-ins.
Mhm.
Sometimes they don't get the letters, they don't reply, which is why they're getting turned out. They remember when they send a request for documentation, they only get 10 days. Sometimes, and that 10 days is the date on the letter, right? So that's likely going to be the letter the Health and Human Services sends out. Sometimes they're getting it 1 or 2 days before it's due. They don't know why they're getting it. They don't know the reason. And so I think it's just going to be educating them, right? We do presentations in the community as part of our outreach work. When we're
Yes.
speaking to families, we're telling them about it, like, hey, did you know that this passed and this affects your family? Like, I think it's just going to be a lot of outreach work, a lot of educational work, and yeah, just getting that information out to the community.
Yeah. And I think it's a win-win for everybody.
Yeah, and that's on ours. Like, policy impacts people's day-to-day lives. It does. A lot of times, unfortunately, in Texas, sometimes negatively, but sometimes also positively. Like, here's a good example of a positive change. So last question I have for Elizabeth and or Karen, both of you. How do you see the enrollment work and this like on the ground day-to-day work that you do connecting to health equity in general and this concept of healthcare justice? What does that maybe mean to you?
Yeah, I mean, I think that question just speaks to the work we do in general at Lone Star, but just because we are dedicating our time to a community that is in need of these services, right? That outside of us, they wouldn't necessarily have access to information or even know how to apply for these benefits sometimes, right? So I think getting these kids healthcare is just going to be vital to their growth. Right? They wouldn't know what to do outside of that, right? So I think it's just making sure that they have healthcare in general. That's probably going to be the health equity part. In comparison to maybe classmates that don't have to worry about this, right? If they get sick, that affects going to school. Maybe they don't have access to school if they get sick and they don't have these benefits. If they have to go to the emergency room, right? That affects them being able to be seen and that emergency getting taken care of. So I think it just speaks to a lot of them having access to healthcare in general. Yeah.
Right. And I think to connect to what Elizabeth just said, we are going to continue to address those barriers that affect them having access, that limit them from having access, those barriers being language. We have of course, along with our language lines, we have culturally competent attorneys and support staff to help when we do the outreach, so that we try to speak the language, so that we meet them where they are, where they feel comfortable. And so that's a barrier that would maybe alleviate or decrease the transportation barrier, because if we're at the community center where they live and where they're comfortable, then we're knocking down that barrier, hopefully. So we're going to try to maintain our work with community partners like yourself, CCPPI, and also continue to address those barriers and look to see and survey our families, our disadvantaged, our vulnerable, our low income families, to ask them why, what can we do to help? How can we get you what you need, what you deserve? How can we help you?
Yeah.
Hopefully, did we answer your question?
No, definitely, both of you.
Yes.
I think, yeah, just the concept that like this isn't that's something that people should have to beg for. It's just something that they should have access to. But I think some of the things that you brought up just around, making sure it's accessible in many languages, your services, that you're going out to places that the communities that you work with are already in, so that there's not a transportation barrier. Like all of those things are really, I think, an equity and like justice lens. So
right.
Yeah.
And we like to say at one of the many things we like to say at Lone Star Legal Aid is justice knows no boundaries. So we try to open that up and try not to be so narrow. We try to listen, and we try to educate, and we do advocate. And speaking of advocacy, I know that you're I know that your passion. I've worked with you, and I know that CCPPI is a nonprofit organization that's dedicated to advocating policies. I know, I think that your background in education and social work and your trainings and healthcare and housing has prepared you to do a lot in the field of advocating. So now I'd like you to tell us, you can tell about that much better than I can. So I'd like you to talk to us a little bit about your organization and who
Yeah,
I
I think,
what you do.
or go ahead, sorry. Yeah, I
that's-
think something that we wanted to focus on, we work on a lot of different policy issues, and yes, one that we connect, we have a lot of resources we've built around and policies we've analyzed and stuff we've written about is that connection between housing and healthcare. And Elizabeth was mentioning the connection between children's health and then their education, right? So all of these things are absolutely interconnected. But I know you wanted me to talk a little bit about Medicaid expansion this past legislative session and kind of where we're at with that now. So unfortunately, Medicaid expansion did not pass this Texas legislative session. There's almost 5 million Texans that live without access to healthcare in our state. There's also research that shows that 70% of Texas support greater health coverage in the state. So we have, much more than a majority of people who live here thinking that something needs to be done about this crisis. There was some bipartisan support in the legislature for coverage expansion, but nothing moved. And then there's also a financial side of this where we're actually losing billions of dollars in federal funds that our state could be getting if we accepted some actual incentives from the federal government on top of that money that already has been offered, essentially, if we expanded to Texas and the 12, actually the other 11 states that have not expanded Medicaid. There were further incentives with COVID and with the pandemic. So yes, Texas does remain one of only 12 states who have not expanded Medicaid. Every other state has, and the majority of those are in the South. We also know that this coverage gap issue that you hear people talk about, this coverage gap is a racial justice issue as well. 74% of Texans in the coverage gap are Black and Latinx. So our organization is planning to work with local and state partners before the 2023 session to hold representatives accountable to expanding healthcare access. But in the meantime, the time really is now for Congress and to kind of step it up, and provide a federal solution to this coverage gap crisis. There is a part of the Build Back Better agenda that's set to be considered in the House Energy and Commerce Committee that would actually permanently close the Medicaid coverage gap starting in January 2022 in those states that have refused to do it within their own state legislature. But yeah, so any follow-up questions or anything on Medicaid expansion? Elizabeth, I didn't know if there was.
No, I mean, probably maybe some follow-up comments, like just explaining like outreach work, you can see how it impacts families. And a lot of times parents are saying, hey, can I apply for Medicaid, right? And because of the lack of Medicaid expansion, we have to tell them, you definitely can apply to Medicaid, but the income limit is so low, right? Because Texas is not expanded.
Very narrow gap.
Right, yeah, and I think something like a
Mhm.
household of 2 for adult caretaker, right? One, the adult has to be a caretaker in Texas, but 2, for the adult caretaker, I think the limit has to be $200 and something monthly, and that's nothing, right? That's not a sustainable living. They can't make that much money and actually be, taking care of their family. And so I think the work that you guys do is so great, just because, if even in the 2023 session that it gets passed, I think that would be so important to those families, right? Because we are constantly getting parents that are saying, "Hey, can you submit an application for me?" Because they themselves don't have health care, right? And if they had health care, they
Right.
would be getting their kids health care on their plan. And so I think that's super important. And we thank you for talking to us about that.
Right.
Yeah, and I think I can also just really quickly explain what we mean when we're saying coverage gap, because it really means people who often work, right, are hardworking, often essential workers, right? And
Often
but
people within that federal poverty guidelines that don't have access to health care. Yeah.
right, and like they don't have job-based coverage, and then they earn too much money to
Right.
qualify or to be eligible for Medicaid, like you said, but then too little to get a healthcare plan in the marketplace. So the gap, it sounds like that wouldn't be a lot of people, but it's millions of people who fall into that gap.
Yeah.
Got it.
And I think a lot of people don't understand that CHIP is children stands for Children Health Insurance Plan, and that there is no adult CHIP per se, if you want to say it like that. When I'm just speaking to groups of people, that's what I say, think CHIP and think adult, and you don't have it. But
And the majority of people are in Medicaid, like Elizabeth was saying,
yes,
the majority are children. There are some, adults with disabilities, and
yes,
some we didn't talk about this, but we've talked about it in our conversations, pregnant moms and then postpartum moms, but
yes,
it's that's a small percentage. There's so many
Yeah.
adults with children and without children who just don't
Yeah.
have coverage.
yeah. It's such a big gap. And so when we talk about the gap in coverage in Texas, it's big. And so it's important to get the education out. And in saying that, when you connect, when you're with these groups and in meetings, Jordan, your essential purpose or the purpose of CCPPI, what is that? Are you recruiting people for advocacy, or what are you doing, or what do you hope to do?
Yeah, we're usually elevating campaigns and doing like advocacy for bills that are helpful, like getting this federal solution in the Build Back Better agenda, for example, back in the regular session, pushing for Medicaid expansion. But when that wasn't really, a go, it was too many months in where that wasn't a go. It was pushing for bills like HB 290, which was not getting kids on coverage for the year, and House Bill 133, which was coverage expansion for Texas moms so that they could be covered. It was originally for 12 months postpartum. The bill, when it passed, was 6 months postpartum, which was not as good as a year, but it was better than the 2 months covered by Medicaid that Texas moms had before that, which is just dangerous. So yeah, it's definitely a combination of things, and it's a lot of looking at how these policy issues intersect and working with partners on those different areas to bring those intersections together as well.
Okay. So if people, and that's a lot of information, a lot of great information, people or stakeholders want to find out more about your organization, CCPPI, and find out what you're doing, how can they get connected or get in touch?
Yes. So first, social media. Since we're on social media, I should say that first. We have a Twitter that we stay very active on, and post a lot of really good articles, a lot of advocacy pushes. So if you're kind of in that space where you want to advocate for these kinds of changes, but you don't really know, we're good people to follow on Twitter, and we're always posting things that you can do, how to contact your representatives, those sorts of things. And our handle is at CCPPI_HTX, like Houston, Texas. And that's the same handle for Facebook as well. Also, we put out a weekly brief that has local, state, and national policy issues going on based off the different focus areas that we have. So one week it's an affordable housing focus, the next week it's education, healthcare, criminal justice, and so on and so forth. So anyone can reach out to me at jordan.everett@ccppi.org if they want to get those notifications once a week, or they can go on our website and sign up, which is ccppi.org. And then I think that's all.
Okay. So Elizabeth, did you have anything more to add before we thank our guests?
No, that I've covered it all. Yeah.
All right. Thanks, everybody. Thanks, Jordan. Thanks, Elizabeth, and all our communications support. We have been at Facebook Live on September 21st, and we've been talking to Jordan, who is the program manager at the Center for Civic and Public Policy Improvement. She's been our Facebook guest today, and we appreciate you for coming and for the important work that CCPPI is doing. And
Back at you both.
here.